So this will be a short video just over some common conditions that we see with joints. Just like with every unit, I'd like to talk about a little bit of disorders. So on the note page, we have three that we're going to look at: osteoarthritis, rheumatoid arthritis, and gout. So maybe you've heard of all three of those. So on the PowerPoint, you can pull that up, but I only care that you write down what's in red. So what's in gray or black, you don't need to write. So osteo again means bone. Arthritis, you've probably heard of. This is a chronic condition, which means a condition that has taken place over time, characterized by the breakdown of the cartilage that is on your end bones. So this is pretty much as you've gotten older, you start to see that cartilage, that hyaline cartilage breaking down. And so what happens, and again, what you need to write down is in red, you're going to see your bones that where they're joining is going to start rubbing together. And so that's going to cause pain, swelling, and you're going to have loss of motion there. So this is really kind of more age related. I guess some people get osteoarthritis quicker than others. And so we're going to see this mainly in your hands, your spine, your hips, your knees, your ankles, where you use them a lot. So the difference between that's osteoarthritis, chronic condition characterized by the breakdown of that cartilage. So this is one of your synovial joints, and so your synovial joints have this membrane, and then there's this synovial fluid that's in there. And then we've got that hyaline cartilage, that articular cartilage at the end of our bones. And so what happens as this fluid lessens and as this cartilage wears away, we start to see these bones coming together, and we can get bone spurs, but it's this rubbing together that's giving us osteoarthritis. So that is different than rheumatoid arthritis. So let's look at the next one. Rheumatoid arthritis is actually an autoimmune disorder. And so auto means by itself, immune. Basically, it's your body attacking itself. And so rheumatoid arthritis is your body is actually thinking that your tissue itself is invading, and it starts to attack and wear away that synovial joint. So unlike osteoarthritis, which is just overuse of those joints, this is basically an internal attack. And so what we're going to see says, unlike the wear and tear damage of osteo, it affects the lining joints, causing painful swelling, and can even result in bone erosion and deformity. And so it can affect more than just your joints. Again, you just need the red. In some people, this condition can damage your other body organs, as your skin, your eyes, your lungs. So this one is autoimmune, and there's a lot of autoimmune disorders. And so we see basically this cartilage is being eaten away, and we start to see the bone being eaten away, and we see swelling in this. So it's not just an erosion that occurs with natural use. And so this is usually genetic. And so this is an example of someone with maybe late stage. It causes that deformation of the hands. And so you've seen people that might have this problem with their joints. All right, I liked this slide that I found. So this is showing a normal joint with your tendons and your synovial fluid and your cartilage not rubbing against each other. Osteo, over time, we're going to start to see those ends of those bones rub together as this cartilage thins out. But again, rheumatoid is basically your body attacking this bone, so we start to see erosion of the bone itself. We do see these get closer together, and we get more inflammation with rheumatoid arthritis. So let's look at our next one, which is gout. So gout is kind of completely different. You usually see this in like your toes, especially your big toe. We get some deposits of a mineral, and we get uric acid that crystallizes in that joint area and causes a lot of pain. And so again, what's in red is what you need to write. So again, a lot of times you hear about people having gout in their big toe. My father-in-law had gout, and he would drink alcohol. He drank beer, and he drank it every day. And he just kind of just dealt with the gout that would happen, those attacks of that uric acid. So here's an example of what's going on. Can happen with the other toes as well, but we a lot of times see it in the big toe. We start to see these crystals forming in that joint itself, and then it starts damaging that acid, damaging that bone, and they cause severe inflammation and pain. So those are our 3 joint conditions for this unit.